Hello, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, Brad, we're going to talk about fibromyalgia. We have a three-step approach, exercises and treatment to managing it. You don't heal it, you don't cure it, you don't get rid of it.
Not yet.
Not yet. Hopefully they're in the future. By the way, this video is being done in cooperation with Thermatex, which is one of the steps we're going to take today to try to help manage the pain. Fibromyalgia, a little bit of a strange disorder, isn't it, Brad?
Yeah, it's one of those kind of mysteries in a way.
It is, and they don't actually have a diagnostic test for it. What they have instead is they rule out other things, and when it's all said and done, then they figure out that it's fibromyalgia. And you may be wondering why I'm wearing this strange shirt.
Yeah.
So that's one of the signs of fibromyalgia is there's 18 trigger points. So,
Bob, we have to stop. Your microphone is all plugged up. There.
All right. Do you think they heard me?
Well, I hope so.
All right.
We get those, concerns sometimes.
All right. Okay. So these are the trigger points, Brad. Let's kind of talk about where they're at. So we got 2 up here, up by the neck, 2 right below the collarbone.
Sure.
We've got 1 here and here. I don't have those marked. Right by the elbow.
Maybe I should get a marker mine.
Yeah, maybe you should have. And then we got 2 by the knee. And you could also, we turn around, this is where you can see a whole bunch of them.
Right.
2 in the suboccipital area, 2 on each trapezius, 2 on each trapezius, and then 1, if you pull this down, on the buttock, and then subgluteal right in there.
Right.
So anyway, the reason I wanted to point those out is when we use the Thermatex, we're going to catch a good 6 of them in one shot.
Yeah, sure.
So it works out pretty well for that. So our 3-step approach, well, Brad, maybe I should take care of the housekeeping.
I did notice we've got a couple hundred people out there wondering and asking questions about us.
Hi, folks. Today, we'd like to have you come in and subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, please wander over to Facebook and like us. Brad and I had imaginary friends as children, and now we'd like to try to have some real ones, right, Brad?
Well, yeah, we're working on it.
Yeah, okay. So again, the first step to fibromyalgia, one of the things that's going to help is throughout the day is to control your breathing, Brad.
Okay.
And diaphragmatic breathing, and also I like the 4-7-8 method.
Sure.
So what's nice to do is we're going to have you take the Thermatex, and we're going to talk about this in a minute, but I want you just to lay down on the Thermatex.
Okay.
And then start with your breathing exercises.
Maybe we should talk, what is a Thermatex?
Well, I was going to get to that.
Oh, I'm curious, Bob.
I was going to show the breathing first, and then we'll talk about the Thermatex.
Say no more. Say no more.
Now, Brad, you used to teach breathing in karate, right?
Well, all the time. Between that and Aikido, breathing is, you learn how important it is, not just in there, but in life. You learn how to breathe properly. You learn how to relax. You learn how your body functions much better.
It's funny that you mentioned that because I just saw a study that showed that they found people that were anxious tended to be shallow breathers. They weren't learning to take the deep breaths.
Right.
And so this is breathing is very important. I mean, anybody who's had, a spouse, or if they went through it themselves and had a baby, they realize how important the breathing is.
Well, yeah, they use it all the time with that.
So, I like to get in a comfortable position, and this Thermatex works out really good here. I have a rolled towel underneath the neck like this, so it kind of puts me in a nice position. And I don't know, do normally you have the feet up or down, Brad? With the knees up for a diaphragmatic?
Oh, I think the knees up, but whatever you're more comfortable. But I think that would be preferable.
A little more comfortable, yeah. So you're going to breathe in for 4. That's the 4-7-8.
Sure.
Breathe in for 4, then hold your breath for 7, and then blow out for 8. So that's the 4-7-8.
Okay, let's see how it goes.
So when I breathe in, you want to actually fill up the belly and
Sure.
fill up the diaphragm, expand the diaphragm. So I'm going to breathe in.
So you can see his stomach is coming
up.
And not his chest does too, but the stomach actually comes up more.
And then you want to breathe in through the nose if possible. And then you're going to hold your breath for 7. 1, 2, 3, 4, 5, 6, 7. And then you're going to blow out like you're blowing out a candle.
Okay, so you're blowing out in the nose, out the mouth.
Right.
And that's very typical for...
And if you want to be, completely correct, you're supposed to put your tongue on the top of your, what is that, part called?
The roof of your mouth.
The roof of your mouth,
just behind your front
Boy,
teeth.
this is already warming up,
Oh,
Brad, by
yeah.
the way. This is actually, it is actually getting the base of my neck and,
Sure.
and the upper trapezius just in the area that we'd like to. So you're going to do the breathing exercises while you're on the Thermatex. So let's talk about the Thermatex, Brad.
How long are you going to be breathing like that? 10 minutes?
I would say, you know, I don't even know I think you don't even need to do it that long, Brad.
Sure.
I think you go through like 5-6 cycles and it'll start calming things
Sure,
down.
yep.
You know, I don't know that you even need to do that.
Okay.
maybe.
So what about the Thermatex?
All right, Thermatex, this is a company out of Calgary. I was
Yes.
going to say Canada and Calgary at the same time, which is impossible.
Sure.
And it's a family-owned business. They make, this is called far infrared heat. And I think this works a lot better than regular heat for a number of reasons, but one of the main reasons is regular heat only penetrates 2 to 3 millimeters, which is like this.
Right.
Far infrared heat can penetrate up to 60 millimeters, 6 centimeters, which is
Just over 2 inches.
2.36 inches.
Not quite 2.5, but a little over 2.25 inches. It's deep.
So
Much deeper
that
than-
penetrates really well. So when you're going for those trigger points, because when people describe the pain with fibromyalgia, Brad, they're always saying it's a deep pain.
Right.
It's a deep muscular pain.
Sure.
So I think the Thermatex, and I've been reading where a lot of people, you know, I was reading some of the reviews on it, and a lot of people who had fibromyalgia said it did help them.
Sure.
So, and I like the fact, Brad, that it's got really just one setting, doesn't it?
Right.
You
That's all
turn
it
it
has.
on, and it goes to it. It penetrates real deep. It's got, this one is the Platinum model, which is the model I would probably recommend for
Sure.
if you have fibromyalgia.
It's got 3 panels, and you can tell, you know, this is the side that would go towards your skin. You can't do it the other side. You have to do the side that has the firm
Yeah,
panels.
the hard panels go towards the body.
Right,
And-
the
and you use
colorful
it- writing. Yeah,
right,
gives it
logo
away.
there.
And it's got a nice 8-foot cord, which you appreciate because, you know, usually it's tough to find an outlet somewhere, right? So,
You got to pull the furniture to the
right,
outlet.
right. So it works out real well with that. This has been approved by the FDA in the United States and also Health Canada.
Right, so
which
it's
is
been
the-
around, it's
Yeah, the
notable.
counterpart. Yeah, this company's been around for like 20 years.
Sure.
So they have other, I just want to mention they have other products. I don't know, how is my mic doing now? Oh, geez, I'm losing it.
You're dragging it.
I'm really having trouble with my mic today. They have other products. They have, this one's just for feet. It's the big slipper.
Yep.
Works out real well for some foot problems. This one's for the wrist. Another one for the wrist. Oh no, this is for the knee, right?
Knee or elbow, yep.
Yeah, knee or elbow. So, and they also have one real big one just for the back.
Oh, so it gets a whole, the trunk area.
Yeah,
It's like taking a hot tub bath.
Right, right. So we'll put a link down below. You can take a look at it, see what you think.
Sure.
You know, you've been using it for your back, haven't you?
Oh
Brad?
yeah, yep. As a matter of fact, last night I was using this one. Before I go to bed, I take a little time to work on my phone or do some reading, and about 15 to 30 minutes. I have fallen asleep with it. They don't recommend it, but you're not going to get burned with it.
Right.
It's actually real comfortable. I woke up and it's like, oh, 11 o'clock, I got to get to bed, but it was very comfortably warm. I was
Yeah, I told a
pleased.
story, Brad, about how one of the ladies from Thermatex was mentioning how she uses it in the winter in her chair. She just puts it on there and uses it as almost like a heating device to stay warm.
Right, yep.
So there's straps on here which help, you can strap it around you to keep it in place. But today we're going to use it in this manner. We're going to hit the trigger points up in here so we can catch 6 trigger points. And what I like to do is, you know, first you start off with the breathing, and then you're going to have a rolled towel like this. We put some tape around it just to keep the towel in place.
Right.
But we're going to start, this is the third step of trying to control your fibromyalgia or manage it, is you're going to do kind of range of motion throughout the whole body.
Okay.
So, and maybe you can show some of these things what I'm doing, Brad. I'll be down in the bed, but you can show upright what,
Sure,
what
yep,
I'm doing.
yep, so they get a better
So-
visual.
I'm starting off with the towel right here underneath my neck, or the back of my head, because I want to do some chin tucks.
There needs to be a gap underneath the neck so he can do range of motion.
Yeah. So I'm doing some chin tucks like this. And Brad, do you want to show what I'm doing
Yep.
on your
So
head?
I just see right under here there's a space, and that's important because what he's doing, it allows the neck to stretch a little bit it's a good postural exercise even if you don't have fibro. But we're working on those upper neck muscles.
Yeah, and it hits those trigger points that are right in the suboccipital area. That's why I like doing those. And then you can just do some gentle rotations back and forth. And that's the same reason, again, why I wanted the towel there, Brad, so that you could do some rotations. And then you can do some side bending.
Right, so he's going this way.
You want to show how you can even do a little bit of stretch with that, Brad?
Yep. So you go here, just fingertips. Don't grab with your whole hand and pull, but just gentle stretch with the fingertips. And you're only going to hold it for, 3 to 5 seconds is long enough. If it feels good, you can go longer than that. There's no hard set rule on time for that. Go both directions.
All right, then at this point, Brad, then I take this. This is the little key here. The panels are running this way. So I put this underneath here, and it actually kind of fits. Now my neck will fit right into this area here. And you can use a pillow too. And I'll go just like this.
This now is kind of the same concept as some of those cervical pillows where you have the support on the neck.
Now the key about the Thermatex is that it does not have to completely conform to your neck to work.
You don't need contact.
Yeah, you don't need contact. Again, it's going to go 2.36 inches if you're close to it or not. You're going to, because I'm feeling this in my upper neck well. I mean, it's penetrating well right now.
Like a normal hot pack, it has to be physically touching to get to get that kind of feeling.
But you don't with this.
Right.
So now we're going to go to the arms, Brad. All right, so we're going to start getting some movement in the arms. You're going to bring your hands together and maybe just go ahead and go over the head like this. Good stretch. Kind of stretching the chest too a little bit with this. Getting some nice movement. Okay, and then you can go out this way. I'm going to hit the cupboard over on this side. We were going to move out, weren't we? Best plans here. There you go. Look at Brad. All man all the time. Okay, they can go out like this. You can do some, get things moving a little bit.
So generally, we're just looking at some range of motion while you relax. You've done the breathing already. You've got the heat on those trigger points.
And now, boy, I'm really feeling this, Brad. This actually is really comfortable. Now you can take your wrist and go ahead and put it like this and turn it out like this.
So you're doing the flexion with it too?
Yep, flexion and turn it out.
And here.
That's a great stretch.
It gets these muscles right up here in the forearm and up by the elbow.
And you actually involve that trigger point that is right by the elbow there, Brad.
Sure.
And then you can go like this and stretch it into extension, Brad. And Brad, you often mention not to grab on the fingers, but to grab on the hand itself and stretch.
If you get on the fingertips, it's a little more aggressive than you need to be. Get the palm in there.
Now, generally,
just like that.
Generally, the time that it takes to to go through this all, we like to see the heat. It takes about 10 minutes for it to really heat up, and so then you can stay on it for another 20 minutes after that or so.
Sure.
And you can do this throughout the day if you want, but you certainly can do it twice a day.
Sure,
just to
you
start.
bet. Yep.
Then we're going to go to the lower extremity, and we're going to start doing just some gentle rotations like this, Brad.
Yep.
Now this is getting the hips and the back when you're moving this way.
Right, so you can see the hip has to come up right here, and that gets the lower back. Plus you got some stretching with the hip. And anything with fibromyalgia, you're not gonna do too aggressively. Everything is,
right, gentle, within tolerance. A hamstring stretch, you can just grab the back of your knee like this and then bring the foot towards you.
Right.
Just a gentle stretch. Same with the other one, bringing it forward, gentle stretch. I can put this leg down if I want to stretch more.
Yep. You'll feel those hammies right in there stretch.
The hammies are barking.
Ooh.
All right, then you can go ahead, just a single knee to chest, Brad.
Yep.
And another single knee to chest. Are you nice and relaxed, Brad?
I am, Bob. I'm ready to take a nap.
And then I'm going to go ahead and just bring my foot toward me.
So yeah, he's dorsiflexing, getting the heel cords. There you go.
Down
ankle
and
pumps.
And then, and then a few circles, Brad.
Oh yeah, circle those ankles.
And
Am I in, Lonnie? Am I out of the picture?
You're out, Brad.
Probably better if you be out of the picture.
All right, so we've just worked the whole body, Brad. We're relaxed because we did our breathing. Where the heat is helping calm those trigger points down. They really are, the Thermatex is really good for providing deep short-term relief of the pain. And now you can go ahead and function and go ahead. this would be a good time to maybe get up and go for a walk.
Sure, yep.
So it's a really great exercise for you.
Sure, and you know, 15, 20 minutes or longer, depends on what you're used to.
Yep.
So,
All right.
once again, Bob, I think we've got another step towards that pain-free body and...
A broken heart? Is that what you're talking about? I don't know. What else are you talking about? We can fix just about anything
Except for the broken heart. But I'm thinking
But we're
this
working on
might
it.
be a good step in the right direction.
All right. Thanks a lot, guys.